talking about this in this meeting, and the members here and the musicians are getting on top of it because it's a serious issue. And the worst thing we're worried about is people be confused and we'll just wait and see how it works out. And hey, I've been okay before, maybe I'll be okay now, and they'll miss out on something that's good for them, good for their families, and gives them health care protection. We had a meeting the other day, and you start talking about these figures, and one of my organizers said, "Uh-oh, you're math shaming," but hey, this is math that helps us, and that's why I did the chart.
As a single person, if I'm making, that means 11,490, is that what the basic that's 100%?
That's 100% of the poverty
line. Poverty line. So if I was making $45,000, I would be 400% over the poverty line, but I'd still be eligible for benefits.
Exactly.
Okay.
Is this adjusted gross income based on your 1040?
Based on whatever taxes you file.
Yeah.
Hannah was reminding me is that, you see this 133, you'll read in the paper sometimes 138 as opposed to 133. 138 is gross, and then 138 is the adjusted gross. So that's the difference. So, I'm take them and then you.
Okay, so let's say if I have a family of 5.
Yep.
And it's saying 5 people on the 400%, they say they have 110,280, right?
If you make less, if your family income
It's
for a
less
family of
than
5 is less than $110,000,
4%.
you're going to qualify for some level of subsidy.
Yeah.
Now, if you're coming in at 300% of FPL, you're going to get probably more subsidy than if you're right at 400.
Yeah.
But if you're at 400, you're going to get something.
Yeah.
Okay, I had another question from
This insurance, are they going to be higher or lower depending on your risk factors and things like that, or is everybody paid the same rate?
It's not based on risk. So every plan will have what's called will involve what's called a QHP, a qualified health plan. So there's some basic components that every plan in order to qualify will have to have. That's going to be preventive work, a medical exam every year, and a basic package of things that is exactly the same for everybody. And there are no disqualifications based on, or as we understand it, differentials based on prior medical conditions. So all of this is about getting everybody in the risk pool.
Okay, well, maybe I can rephrase my question then. They can't refuse anyone, but can they charge you such a high premium that you can't afford it?
So let me help more. So an unaffordable plan, by definition, that they cannot sell, would cost you more than 9.5% of your gross income on an annual basis. So if you had job-based insurance, the 3 or 4 people who raised their hand, and that insurance was to be on that insurance, it cost you 11% of your gross annual income, you would be eligible to go on the exchange. If it was less than 9.5% of your gross income, then you're with your employer. That's where you need to get your insurance. So the rates this year are based on the actuarial guesses. That's all actuary really is anyway, of how big the risk pool will be. If the risk pool turns out to be larger than anybody expects, if more people enroll, then we're likely to see a decrease in the rates in the second year. If all of a sudden half the number of people they predict are going to enroll, you're going to see an increase because you have less people in the pool. We're trying to get people, obviously, to vote with their feet and enroll because that's better for you. You have health protection, and it's better for everybody else because it's more affordable. I don't know how to say it any more simply than that.
No, that's great, thank you.
The other problem you'll have, particularly for the 3 or 4 of you with employer-based insurance, is big companies with more than 50 full-time equivalents were exempted for another year from having to pay a penalty. That penalty was going to be $2,000 a person if their plan didn't qualify and was not affordable. In other words, I was bargaining last week with a healthcare company. We represent 400 of their workers. And if you enrolled in the insurance, you'd be paying 21% of your gross income on that job to be part of the health insurance program. So, from what I just said, that's not a qualified plan. Now, so I asked the employer's representative, well, what are you going to do next year? And obviously they're much bigger, so they're not gonna pay a penalty. Oh, we're gonna move to a high deductible plan. Well, they already have a high deductible plan. Unless they figure out a way to get the premiums down, and the employer has to pay at least 50% of the premium. So unless they get it to an affordable level, and this is for workers who in some cases are making $9.50, whatever, they're gonna have to really get that down. It's gotta be that standard package, so they have to improve it. So I was actually trying to bargain with them, okay, this year you don't have to pay $2,000, why don't you subsidize my bargaining unit in the exchange, so that instead of them paying $100 maybe a month, they'd only pay $30 a month this year. And it still says you might, well, I didn't say he agreed yet, but the truth is, employers here 2 weeks before the deadline have no idea how, even with big companies and big labor relations departments, have no idea how they're going to structure their own employee-based health plans. It's ridiculous. I had another company I bargained with this afternoon. You know, we represent all the guys, you know, if you watch a garbage truck, the guys who are throwing the trash in, those are hoppers. Those are covered under contract with my union. Well, believe me, none of them have health insurance. And so I'm having to have a conversation today about this contract. Well, what's your plan, Stan? What are you doing? Yeah, no plan. Well, I mean, this is crazy what we're facing. For some people, they're going to find out that even though they were ahead of 100%, maybe their children are eligible or there are some other programs that affect them, which is why we should still plow forward. And frankly, you know, as navigators, we sort of swear, you know, we got nothing to say and we can't tell you what's up. Hey, this is a better policy for you than that policy. But we definitely are keeping a second list for anybody who's disqualified for that reason. Hey, you want more information? You might want more information. Sign up with on Local 100's list here. And because for all these people who are disqualified, once they really find out what it means to them this year, I'd be surprised if they don't reach out for Baton Rouge next year. And they need to. I mean, people just have been confused about this, so you haven't seen the real uproar. We have 400-something thousand people that are being denied health care because of the lack of expansion that cost citizens in Louisiana $0 for the next 3 years. Yeah.
I have a question based on a couple who, one person has insurance, who is job-based, the other person is a musician. And we qualify in that chart for this qualification. Does the person also qualify who has job-based insurance for a discount on their insurance through their employee?
This is a huge issue because critics of some of the failure to make changes in the ACA believe that there was a penalty put on exactly people like you who are part of the family. Now, the only way we know you get around this is if, between the two of you, if they put you on as a spouse or whatever, dependent, if that would have made that policy unaffordable, meaning a cost of over 9.5%.
So if I put the musician on the policy, just making sure I understand what you're saying. So if I put the musician on my healthcare policy, and that would lower our chart rate, then I'm not sure I understand what you're saying.
So if you, here's what I'm going to say two things. One, I'm going to tell you, make sure you give us your name and number once this is over so that I can confirm this. But here's my appreciation of what this case is. If the two of you ended up with a gross income of X,
Okay.
and your cost for your insurance, the employee-based insurance, plus that dependent, through that total cost over 9.5% of your,
Okay.
then I believe you have the right to go to the exchange.
Okay.
If it's still within that 9.5%, you're barred from going to the exchange as a dependent.
Okay, and then we're just
SOL.
SOL. Okay.
Yeah.
All right.
And people can't go separate?
Not if you're a joint filer.
Okay.
This navigates perfectly. I can't give you personal advice, but
For those that currently have employer-based insurance, given the rounds of layoffs and things that happen,
right.
if somebody's laid off, then do they immediately have access to this, or is there a certain period where there's still either mandatorily covered by the employee's insurance and so on.
So that's another excellent question. You know, for 90 days after you're laid off, you have the access to COBRA, which means that you can pay those payments. But you're paying both the employee, when you pay COBRA payments, as many of you may know, or I guess there's so few job-based insurance, a lot of you don't know, you're paying your share and the employer's
Right.
share. So sometimes, you know, that might put you way over any perspective of gross income. And here's what, well, no other controversies, but it's actually a great thing about this particular program. Because the IRS is the final enforcer on the cost, if there's any question about your income or whether or not they're going to go ahead and put you on insurance now
Okay.
and work it out with you on your taxes. So if all of a sudden, same thing, let's say you qualify now under 400% and you know, your record hits big, or, you know, your boat comes in, or you go to, you know, the casino, and so your income changes. Well, how are they going to handle that? Because you were paying one thing, your income doubled. Well, they're going to change what your rates were when it comes to your tax refund. You may have thought you had 1,000 coming, you may find you only had 200 coming once they settle up with you. But it's done in advance because the policy that's driving this is the recognition that everybody in America needs health care. So, you know, some people say, oh my God, I can't believe you're letting people get to care from the government, you know, paid for by the government before you find out for sure their income didn't change. Well, thank God, we're going to keep them alive, and then we'll keep them productive, and we'll collect later. So it's all a settlement at the end. And if your income drops, or you get laid off, or your health insurance that was job-based and less than 9.5% turns out to be COBRA, and all of a sudden will be 20% of your income, then you're on the exchange.
Yeah. Thank you.
Last question.
What about more veterans who get their free medical care?
You've got free medical care.
Like is any of the other chairs?
We're all trying to get where you are. This is our effort, you know, no matter how healthy or unhealthy we are, young or old, we're just trying to get what other people have. But yeah, you're in good shape.